On county preparedness. How prepared is your county to handle the COVID-19 pandemic? That is the question we are asking you on Twitter this morning. Get online, tell us what you think, what you have observed, how you feel could be better served by your county leadership in terms of COVID-19 preparedness. I'm at Trix Ingado. Michael is at Michael G. Gitonga. The hashtag to use on this morning is KTN Morning Express. How prepared is your county to handle the COVID-19 pandemic? And of course, if you have been keeping up with the news, you do know that traveling is now allowed. Inter-county traveling can happen right now, and the biggest fear with that was that we might be see increased or spikes of infections at the county level. But we have been warned that you cannot be airlifted back to Nairobi for better health services. So that means the onus falls on the county leadership to ensure that you are taken care of at the local hospitals. So let's hear those sentiments from CS Mutahi Kagwe on how you can no longer be airlifted to the city for health treatment.
The reason why we are saying that moving forward, there will be no evacuation of persons for COVID complications from the counties to Nairobi. Not out of will. It is out of the fact that by the time we get to that position, the hospitals in Nairobi are themselves going to be overwhelmed. You know, it's better to speak the truth. You know, the Bible says, the truth shall do what? The Bible says the truth shall set you free. And I want to tell you that moving forward, if the modeling that we have done is correct, then it will mean that by the time you are thinking about evacuating COVID cases to Nairobi, Nairobi itself will not have any bed capacity whatsoever. We are expanding that capacity. In the next 30 days or so, we will probably have expanded with another over 1,000 beds in Nairobi, but even that may not be sufficient for the cases that we might get. We are praying and hoping and trying to contain, and indeed if everybody does what we are saying, there is every likelihood.
Remember, to be a part of this conversation, you can give us your opinions via Twitter, Facebook, and Instagram. We have here Jacob Matlala telling us that on county preparedness for the coronavirus, my Nyamira County has nothing to call. They have no beds or ventilators. So some concern coming there from Nyamira County. Now we are being told, well, you can give us your experience at your county and we can go on and pose these questions to the governor of Isiolo, who is Mohammed Kuti, who's joining us this morning. He is also the chairperson of the Council of Governors Health Committee. Welcome to the show, Governor.
Thank you. Good morning.
Yes, the big question that we are posing to the people, our viewers and the people online, I'd like to pose it to you just to kick off this interview. How prepared is your county of Isiolo as far as COVID-19 is concerned?
Well, preparedness is a factor of many issues that has to be considered when we talk of preparedness.
Yes.
Number one is the governance structure. We have formed the County Emergency Response Committee, and this committee meets every Thursday at the county level. But also we have formed structures at the sub-county and even the ward level. And below this are the Nyumba Kumi and also the community health volunteers. These are actually very important at this particular time when the home-based care protocol is now being rolled out, because it is this Nyumba Kumi and also the community health volunteers who actually will create awareness at the community level and also ensure the protocols are followed in the home-based care that's going to be rolled out now.
Yes, let's unravel, or rather demystify, the Nyumba Kumi and the role they will be playing. Literally, those clusters, how are they going to go into enabling the county deal with a possible outbreak? Let's say if someone is seen to have symptoms or someone dies in a certain neighborhood, how do they come in, or how do they help to prevent spread of COVID-19?
They are very, very key, because number one is the creation of awareness among the community.
Yeah.
And number two is they are the ones who will actually educate the community about the protocols, how a positive case should be isolated, how he may be fed, how to prevent infection among the family members, so that he or she could stay away from the other members, so that he does not or she does not infect the other members while still getting care from the members. Number two, it's also about the visitors, because still in my county, the cases that we are getting, we have not reached the level of inter-community or within the community transmission.
Right.
We are still getting cases that are coming from outside. So the Nyumba Kumi and the community health volunteers, especially the Nyumba Kumi, participate in the identification of visitors, especially from counties that already have cases, like Nairobi, and they have assisted quite a lot. They also participate in the contact tracing, very, very important, because if, for example, a patient comes in a vehicle or a bus and the passengers are light and there is a positive case on that bus, for example, like our case 1, we were able to trace up to 90% of all those passengers on that vehicle using the Nyumba Kumi and the community health volunteers, and that helped a lot because we are able to trace them, test them, and luckily all of them turned negative.
Okay, now that is at the community level. Let's talk about the hospitals and the facilities that you have at in your county. Do you think are you at that bed capacity that we have been hearing of, the 300 bed capacity for the isolation wards, as well as, you know, the labs and the testing kits? It has been quite difficult, as you have been on record saying, having test results coming all the way from Nairobi. Is your county prepared? And let's also spread it also to the other counties as you sit on that Council of Governors Health Committee.
Well, at the hospital preparedness, we have 217 isolation beds. Yes. We are just short of, in fact, our target of 300, we are just short of that. We were in discussion even last night with the health team that by latest 10 days, we should be able to have the 300 minimum, because we are ordering from KEMSA. And also we want to encourage even our young people to participate in the making. In fact, last night that was the discussion. Maybe the remaining balance we should contract our young people to just make, you know, basic beds.
Now, when we're talking about ventilators and facilities such as the ICU beds, those are quite specialized. Surely we cannot expect them to be locally procured.
Well, I'm talking about beds. Yes, but as for ICU, we have now 13 beds, 6 ICU beds which are fully operational. We have 7 HDU beds, and a total of 7 ventilators right now. But we intend to increase this also because we have gotten the funds from, in fact, we have converted the Kenya Devolution Support Program funds, which we have all been allowed, all counties have been allowed now to use the KDSP, Kenya Devolution Support Program. It's a World Bank fund. Okay. We have now 30 million of that to convert to support COVID and to improve our capacity to handle. But I think also we should also look at the health workers, because that's another form of preparedness. For sure. We have now added the number of doctors, clinical officers, and also through the national government, we have improved the number of health workers. But it's more important even the training component, because we have now trained all our health, 100% of our health workers are now trained to, in preparation for how to handle COVID cases.
Yes, this is in Isiolo County, right?
In Isiolo County, yes.
What about the other counties? Because reports do come in of people being trained via the internet, some of them not even having the hands-on sort of, training that would enable them know how to take off the PPE kits and not be infected or reinfecting themselves as they take care of patients. And also isolation of these health workers is not happening because they take care of patients and they go back home, and obviously they could be the spreaders of COVID-19. So when you look at that, and when they every other day cry for allowances that are not arriving, what would you say about that particular issue?
Well, I think various counties are at various levels of training, but all counties have gotten a certain number of staff that were sent to the national government and got trained, and the people who are trained became TOTs, that is training of trainers. So they came back now to train their fellows in the county. So I think this is the one I'm talking about, and all 47 counties have sent their staff for training to get TOTs to come back and train the health workers, and that is ongoing, and they're at different levels. We have finalized in our county. In fact, we are now at a point of we are training private facility health workers, health workers who work in private facilities and even faith-based organization facilities. But the issue also of isolating them is very critical.
Yes.
We now have a hotel. We have hired a hotel so that those health workers who are directly in contact with COVID cases don't go home, actually. They stay at a hotel. They have their own private, not private, but a vehicle provided by the county to transport them to this hotel. And this hotel is now designated to accommodate them until we are through with this pandemic, so that they actually don't infect their family members.
And their communities. Yes. Now, when you talk about these measures that you've put in place in Isiolo County, do they cut across board, or how is the approach of this, the committee that you belong to? How do you make it that you are consolidating all the efforts and you have a sort of more efficient approach towards COVID-19? Because you might be doing this and another county is having a completely different situation.
Well, we, as Council of Governors, we meet every Tuesday.
Yes.
Virtual. These days, because of the pandemic, we have virtual meetings on Tuesdays, and we analyze our preparedness. We share experience. Also, our secretariat actually gets in touch with the technical people and update the preparedness on a rolling basis, so that every week we see how many more counties have attained the 300-bed capacity, the training level for their health workers. All these factors are actually followed very, very closely. As you have seen, the chairman, Oparanya, actually yesterday stated now we have 26 counties. Just a while ago, about less than a week ago, there were 15 counties that were prepared. Yesterday, they were at 26. And I think we are continuously having counties improve their capacity. And in any case, preparedness is not, as I keep saying, it's not like a bulb switch. It's a progress that has to continue. And we are also happy that KEMSA actually has announced that they have PPEs worth 2 billion, which the counties can rely on in order to make sure that there are PPEs available for health workers in order to protect our health workers from getting COVID as they take care of our
To the patients.
Yeah.
Now, Isiolo County has a referral hospital that has a state-of-the-art biosafety lab that has been authorized to conduct testing so that you don't have to wait for results to come all the way from the city. And when you talk about this collaboration between the governors meeting every week and talking over these issues and seeing a way forward, is there another form or is there hope for more collaborations? Because not every county has this sort of facility.
Well, I must say that all the 47 counties have a machine called Gene Expert machines. Gene Expert machines actually are used for testing TB. And the Gene Expert machine, if provided with certain cartridges for testing COVID, we will have actually have the capacity for all the 47 counties to do COVID testing. But the problem is the unavailability of these cartridges. And the Ministry of Health have been really struggling to get, testing is a worldwide challenge.
Yes. So
we are only now able to have about 26 or 28 testing facilities in the country. And we are hoping this will increase, especially if these cartridges that could be used by this Gene Expert machine could be availed. Then all the 47 counties actually could be doing their own testing instead of referring the samples for testing either in Nairobi or to the other 26 testing facilities.
Right. Yeah. And as we have a set number of beds that are required, we also receive reports of people being turned away from hospitals, because the hospital is just not going to touch a patient that has COVID-19 patients because they are not secure in terms of themselves, feel that they are not secure or able to handle COVID-19 patients. What would you say to those particular, situations and hospitals?
Well, I think we have to accept the fact that we are having a pandemic. This is a highly contagious, highly infectious disease. But at the same time, also, we have competent health workers who are trained, and we also have adequate protection for them for the time being, because we have not yet been overwhelmed. So I think at this particular time, there's no reason why patients should be turned away. But I think also at the same time, we need to accept and start utilizing the home care-based protocols for patients who are only positive, but basically they are healthy. There are a lot of cases, quite a large percentage of our patients in Kenya and even in Africa in general have been found only about 2 to 3% progress to severe conditions requiring admission.
But Governor, that would require PPEs for those who are taking care of these people. It will require them to be isolated. It will require them to actually have some sort of support, as you see in other countries, whereby they are brought food and shopping and things like that. Can that be guaranteed at this point in terms of counties and how they have budgeted for their care for?
I think various counties have various capabilities.
Yes.
For nomadic and also rural counties, it may be very difficult because most of these people live in crowded and also in let's say, urban slums. It may be very difficult because the homes are already crowded, there are no rooms for isolation. Those are the challenges, and no partitioning, and therefore the distance between the sick and the other members of the family is a real challenge that we must accept. And I think that's not what I'm talking about. There are also counties that are endowed, there are counties that a good portion. Every county has those kind of challenges where there are less, endowed families who are living in crowded homes. Those then have to be taken care for in the hospital or isolation setups. But for those who are able to have isolation capabilities at their homes, I think we need to have more, because this disease is increasing. The numbers are going up. Very soon, the isolation facilities, however we say 300 or whatever, we may not be able to, because right now the pace at which it is increasing is such that hospitals will be flooded if we do not start having that plan of having those who are able to be taken care of at home. That protocol should actually be rolled out and communities trained to do the same.
I'd like to know from pastoralist communities, how would your approach be different from, let's say, in Nairobi or in Kisumu or any Bungoma, any other area? How would a community that is always moving about be approached in terms of raising awareness, and even with the Nyumba Kumi? How do you have a Nyumba Kumi when they are moving around?
Well, that's why I'm saying in the communities that are nomadic, it's a major challenge.
Yes.
But even in those communities in northern Kenya that are not actually moving, their housing is such that it's always crowded because of the number of members in the family and also the socioeconomic status. It has also been found that TB is one major complication that can rapidly change the condition of the patient, and TB is very prevalent in those communities. In slums and other areas, actually, also the other problem is the so-called comorbidities. That's the other diseases that are, whether it's diabetes, whether it is hypertension, HIV. And more so HIV, which is very prevalent in the lower socioeconomic members of the society. And therefore, these are challenges in terms of home-based care.
Yes.
But I think, and the Nyumba Kumis will still play a major role in nomadic communities. The Nyumba Kumi, obviously they move along with the members. So it's the members of the community who become members of Nyumba Kumi and members of the community health volunteers. So they move with them, and therefore the services will be provided as they move. But obviously it's a challenge, and that is why we're saying maybe the national government should support counties with those kind of special circumstances so that isolation facilities could be expanded, and maybe more resources could be sent to those counties that will eventually not have a home-based arrangement.
Yes,
and that happens also for slums and other societies. Yes.
Now, I would like to know from you, what sort of lessons do you think, as the health sector is devolving, because it was an ongoing process, it hadn't been actualized 100%. What sort of lessons do you think the county governments are picking from this particular pandemic, and moving forward, does the fact that there's a possible spike make you a bit worried for counties?
Well, yes, I think it's now time that this disease has been now with us since mid-March. For all this time, it has been the issue of Nairobi, Mombasa, Kwale, as the epicenters, and a few counties continuously being added. But I think now we are at a point where this disease actually is a reality. It's with us. It's in the counties. Very soon, in fact, in some counties already, community infection has already started. In some counties, like mine, still it is imported, where cases that are positive are always traced back to a visitor from outside.
Yes.
But we need to be ready. I think we need to really up our game. Especially now that the transport sector has been opened, because now it means those people who have been in Nairobi will now travel to Isiolo, travel to Marsabit, travel all over, and therefore the rate of infection will definitely surge, and therefore we need to be more prepared. Now, the other thing I think I will urge is to all Kenyans that the fact that we've been allowed to travel, I think only those who need to travel should travel. I think we should not feel like this is now freedom to travel, and therefore, even for very flimsy cases, we should travel. I think we should realize that the disease now actually is reaching a worrying level. And therefore, all of us should be worried without unnecessary panicking, but we should realize the reality that we are in a tough situation. Everybody should take responsibility. We should avoid unnecessary travel. We should continue the stay home. The stay home order should actually be continued. Face masks should be worn throughout. Hand washing and sanitizing should be practiced. Social distancing and physical distancing in markets and everywhere should be practiced, because we really now are heading to tough times. I think August, September, we'll see a major situation that we, have been seeing in other countries if we do not. And the way it will turn out will be just the way we as Kenyans. And these are, we have said how prepared governments are. But we also must talk about how prepared the citizens are.
Yes.
Because this is a very key component. If we put our face masks, if we keep social distance, if we sanitize and we try to avoid going out unnecessarily, then that much we will hold back this disease. If we say the president has now opened and therefore everybody is out there and discourse and crowding and political rallies or whatever, that much we will run into trouble. Hospitals will be flooded, deaths will be more, and therefore we need to face the reality that this is now, we are approaching the tough time of this disease that we have seen in Italy, that we have seen elsewhere in the world. It is now us to decide how this disease will be. It is all individual, communal, and government combined.
Okay, a very collaborative approach would be the key. Now, thank you very much. That is the Isiolo Governor, Mohammed Kuti, who is also the chairperson of the Council of Governors Health Committee. Thank you so much for your sentiments. We're going to take a short break. When we come back, we'll have more for you right here. We'll be taking a look at the psychological aspect of COVID-19 and what we have had to do and how it's affecting all of us. Now, let's go for that break. When we come back, we'll have more for you.